thank you everybody for joining this session. We're going to cover in this webinar about regulatory reliance, mostly cover for obviously MedTech. Obviously, this can be transferable to pharma. We're going to cover the main concepts, what it is, and as well how to use it, but as well from many different perspectives, in terms of the data related to regulatory reliance, as well what is the state of play worldwide related to reliance. I have the real pleasure of having Steve Lee with me. Steve Lee is the Director of Diagnostics and Digital Regulations at ABHI. So thank you so much, Steve, for joining. It's a pleasure having you here.
And thank you for inviting me, Armin.
And then we're gonna be covering this topic. Steve and I, we know for many years now. We discuss about regulatory reliance for long hours as well, related to this specific topic. So we hope this is going to be a very informative session, but as well it's going to be educative in that sense. So as well for you to understand what are the trends in the industry. So to start with, we wanted to give you a bit of the agenda that we thought to share with you. So I'm going to do the agenda. So what is regulatory reliance? What is overseas evidence an option for authorities? What is the state of play for health tech? What are the trends? What does the process, how does the process work? We're going to do a reliance practical case, understanding what are the pros and the cons. What's the authorities' point of view, opportunities and risk for manufacturers? And as well, we're going to share some MedBoard reliance data. So as well is something that you can take away with you, and as well for us that we monitor this information globally as well. So first of all, I wanted to obviously Steve to introduce a bit yourself. For myself, it's a pleasure to have Steve, someone that I admire in the way of like working and so on, and we've shared a lot of time together. So for me, it's great to be spending this time in the webinar. So please, Steve, introduce to people, so people know more about you if they don't know obviously about you before.
Ivan, thanks so much, and thanks for that introduction. Thanks for inviting me to be here. Yeah, it's always great to work with you. Always happy to chat with you. If you don't know me, I'm Director of Diagnostics and Digital Regulation at ABHI. I've been with ABHI for all 4 years now, nearly 5 years. But I did spend a lot of time with MHRA, working just such a long time in IVD's policy and training and doing post-market surveillance. I was chair of the IVD working group in Brussels, and I'm also a director of TOPRA. I'm in the second of my 2-year term as a TOPRA director. I do some work with a company called Regmetrics, and I also kind of do a lot of work with IMDRF and GMTA. IMDRF is the International Medical Device Regulators Forum, and industry is allowed to join in with some of those discussions, and usually that's through the Global Association of Medical Technology. So that's the GMTA. And I've done other things as well. I'm really keen to take part in these kinds of discussions, Ivan, with you.
Thank you so much, Steve. So you can see, everybody, that Steve is the right person to speak about reliance, as he's been quite involved in all these discussions. About myself, if you don't know, I'm the founder of MedBoard and as well the CEO, and I've been working a lot with medical companies, developing, but as well submitting and so on. I use reliance, so I can as well put up as part of this conversation as well my experience with reliance in different processes as well. So that's about myself. So we're gonna crack on, and the first question we're gonna do in a very conversational type webinar as well. So we're gonna be asking questions to each other as well. We're gonna leave as well some Q&A at the end as well for anyone from the audience to ask. But the first question to ask, to Steve is, what is regulatory reliance?
If you look, as you got on the slide there, the two elements of recognition and reliance. I think recognition is at one end, and then you get different forms of reliance going along. So recognition would be the full recognition. It's like what the UK has for CE marking, and in fact, all the European countries, all the countries in EFTA and EEA, and all of those countries which accept CE marking, both within the EU and outside it, they accept a decision by a third party sometimes by the manufacturer, if it's a self-declared device, or by the conformity assessment body, if it's something that goes through a notified body, and they accept that decision without question. That would need to be registered. That would need to have post-market surveillance. That would need to have lots of other scrutiny from regulators. But it's accepting that initial regulatory decision to place it on the market. Reliance is not that full acceptance. I guess it's that leveraging, using the kind of regulatory information, some of the clinical evidence, or some of the conformity assessment, or some of the standards certification that says, actually, yeah, there's information there which is helpful, which is trusted, but maybe we want to add some additional scrutiny on top of that. And as you referenced here, these definitions are set out by the WHO and accepted by the International Medical Device Regulation Forum as well. So they're globally accepted definitions.
Right. So these are the definitions that countries are using to implement in their policies. That's correct. And one of the key things as well, recognition, that we always like discuss is the first sentence, is the routine acceptance, right? It means that you're going to accept anything that is coming from the other country as a routine, right? So you don't make any intervention in terms of I'm going to assess this one or the other ones or the high risk. You just take, the whole acceptance, from the other country.
Yeah, it doesn't have to be everything from that country. You could select which products. So it could be just low risk products, or just these products or those products. But it's like a pre-acceptance that they can be placed on the market or put into service. Once it's placed on the market or put into service, then the accepting country's own regulations come into force about what post-market surveillance.
And when we talk about reliance, in fact, there are like two types of reliance that are used by countries, by authorities, right? One of them is the overseas regulatory reliance. So this is taking the evidence that is coming from countries. But the other one is the institutions' regulatory reliance, right? So you can have 1345, you can have other standards, you can rely on institutions that are recognized by those countries, but you can obviously use them in terms of the submission or the registration, and they're going to be a significant weight to the assessment. That's correct.
So would you include in that both notified bodies and certification bodies and other kind of conformity assessment body?
I think in the institution's definition is about certification bodies. Yeah, so any external, bodies as well. And obviously, depending on the country, and we highlighted there are two main areas of reliance. So everybody that has a good experience within the industry, you will obviously, in any conformity assessment, there are like two different steps. One of them is the QMS, and the other one is the product assessments. So depending on the country, you may give more weight to the QMS or to the product assessment, or you will do recognition for QMS, but not for product assessment, and so on. That's something that we will explore now in the next slide. So this is, the main concept for everybody to understand what is recognition, what is regulatory reliance. So I think that many people confuse those terms, thinking regulatory reliance is recognition. So I think it's important as well, in this webinar to start with those definitions.
Perfect.
So the second thing that we want to cover is, I go to the next slide. We wanted to start as well whether the countries perceive the same way, right? So I think this is one of the key things that, and we've seen as well, that we are the same. We are trying to solve the same problems, but we are, say, different, how we approach those problems. And we've seen this as well with the COVID experience. So we've seen that people facing the same risk, they were actually implementing different risk controls, right? So all of them, they were valid to themselves, but obviously they were different. So one of the challenges we have, Steve, as well, is not all countries, they have the same classification rules or even the same conformity assessment approach. And that, changes very much whether you are coming from European, INDRF countries, or you have more US type of, let's say, classification. So obviously, culturally, we are different. We have different conformity assessments, and that's a challenge as well. So Steve and I, we recognize that, like, it could be harmonization, that you impose reliance that you understand each other's and you can take that or leverage that information on, to your assessment, or you have this recognition that you accept whatever is coming from a third party. So what are the key differences for you, Steve, and where you think the trend is going in terms of like harmonization versus reliance versus recognition?
So, I mean, a lot of the discussion at IMDRF and GMTA is around, well, it has always been harmonization. If you remember, before it was IMDRF, it was GHTF, the Global Harmonization Task Force. So it's getting all of those member countries to have very similar types of regulation, have comparable legislation. I think the principles of harmonization are set out by IMDRF very, very well. Maybe not every country applies them exactly the same way, but that's at least those principles are there. I think seeing how global principles of reliance, regulatory reliance, are developing, have been developed and are still developing, is really, really useful. I don't think there's a lot of discussion around recognition, but there is, as we've described already, a lot of recognition. In fact, de facto recognition of CE marking, for example. I think we'll see a lot more by way of reliance, because I think there's an understanding that reliance will raise global standards. Reliance is a way of making sure that all products in all jurisdictions meet those global standards, or are likely to meet those global standards. It needs a lot of support, I think, particularly for where a low and middle income country is using reliance. They perhaps need support to build those regulatory frameworks so that they can be autonomous in their decision making and be able to implement reliance themselves. Where it's an IMDRF member country, so Australia or the UK, or where it's an IMDRF observer such as Switzerland, who are building reliance models, they can still use those principles, but they perhaps already have those frameworks in place.
Because one of the key concepts, right, in reliance is the recipient country always chooses what to accept and how. So countries are seeing a way to keep control while leveraging as well evidence from overseas countries and choosing depending obviously how they perceive the risk, because obviously depending on the country may say, okay, this device for me is very high risk. I'm not accepting this from this country. One example, for example, MD-SAB reliance. Even if Brazil is part of the MD-SAB reliance, they don't accept Brazil decisions, for example. So I think that's the key thing as well in terms of reliance and why this model is getting more popular amongst those high regulated countries.
And I think reliance is more product specific. So the recipient country can use whatever conformity assessment process they choose to have to filter out specific products. If they might say, well, actually, during this reliance route, some of the software will be weeded out because we don't like this principle or that principle. So that might happen. Whereas on a recognition basis, that's recognizing perhaps whole product classes, product types, but then it's that post-market surveillance, that registration, which weeds out the products that they don't want in the country.
Right, which it leads us to the next slide, right? Why overseas evidence is an option now for authorities, right? And how authorities, what are the options they have? And remember that an authority can have recognition reliance on national conformity assessment at the same time. So they don't need to be in just one bucket. They can just be across or spread out across this table. But one thing that we want as well, the audience to understand is the challenges as well from authority, right? So you want to have control, you want to have a lot of assessments and so on. But obviously to do that and to have this control, independence and infrastructure, you need to have as well all the resources to support that. So we wanted to explain in this slide that if you have a recognition direct, obviously you don't need to review the QMS and the product. For you, it's very, very simple. And then you just accept your regulatory decisions of third-party countries, and your infrastructure is minimal. One of the in some countries that we can see with that direct recognition, you don't need a lot to develop in terms of infrastructure. Now, if you have recognition with actions, that is a blended or a merging between reliance and recognition that we're seeing more and more. Does not involve assessments, but it may require registration. So you may go to a country that rely completely or accept completely a certificate, but they still require you to register in their database as a products database, or you may have, additional PMS requirements and so on. Now, if you have a reliance, it means that your QMS, your product information, product assessment information is going to be assessed as part of an application, right? So there's a certain level of control. And you can see the infrastructure becomes very high because then you need to have the resources, you need to have the workforce to actually review all that technical information. And if you have a national conformity assessment, obviously the QMS, you need more resources. And in terms as well, the expertise. So it's not only about resources, it's having the expertise as well to assess the specific information. And even for product, you need even more, right? So you will have full control. We were discussing this before the call. So Recognition Direct would be like UK right now, in a way. And then the national conformity assessment could be the FDA. So they have that. But obviously you can have components of each of those areas. So, one question that I wanted to ask you, Steve, in this slide, obviously we see the challenges with, global regulators, countries. If you ask any country, they are understaffed, right? So they're trying just to cope with the resources that we have. And this is not just one specific country, this is across the globe. So what would be an ideal situation where patients will benefit, in your opinion, Steve?
And it's from my perspective, I've spent 25 years in the public sector. It's all about the patient, and I would say that there are two elements of how patients could benefit. One is access, and the other one is safe devices. So good access to safe devices is the ideal. I think obviously recognition with that minimal infrastructure. You could also say minimal cost. There's if the supply chains exist, then the access is there, and it's not being filtered by on the regulations. But then, does that mean the market is being kind of flooded with poor quality products? I don't think it is, but there's that risk there, because the manufacturer has to in any of these four levels, the manufacturer has to ensure that the product is safe and fit for purpose.
So if we use an example like UK right now is using Recognition Direct, but they want to build, they have this roadmap and so on. So they will need to move to recognition with actions, reliance. So obviously they need to think how, and I think that's part of the discussion they have right now, right? They need to think how is going to be the roadmap to build more infrastructure, right? Depending on the actions, that obviously that's not decided yet, but they will need to see how they can move, especially for the high-risk devices, whether they delegate that to specific conformity assessments, bodies, or so on. But obviously, they will need to look into how they can manage that balance. That I think that's the problem, Steve. Right? You cannot have all those specific benefits. You need to compromise at some point, especially for the authorities.
So would you see, whether it's the UK, Switzerland, or whoever, having perhaps a blended approach, having a hybrid of perhaps 2 or 3 of those 4 different levels?
I think the trend as well is depending as well on the level of risk as well. So how they perceive the risk. So what we're seeing, especially with data, is the reliance is getting more popular with high regulated countries. So I think like countries will try to find a formula that works with them and fits with their systems and policies. I think but obviously this is a long process, as you know, as well, like how you can implement something that aligns with your country.
And you said on the very highest level, the national conformity assessment level, that's probably like an FDA style approach. That not everybody can actually put in the resources for an FDA style with thousands of staff. What are the risks if somebody puts in to patients with a national conformity assessment type approach with that very high infrastructure?
I think that's the challenge really is first, do you have the infrastructure? Do you have the resources? Do you have the expertise? Because even if you have a really good budget, you need to find the people actually to review it, that information, right? So it's just about keeping the balance. I think in terms of like global, if you have the evidence like globally that a product is safe and effective, and then you have the mechanisms also to do a good post-market surveillance and as well market surveillance from the authorities, that's something that it should work because now we are moving into more information sharing information as well globally. But I think it always depends, and I think we cover this in the next slides as well. That is this dilemma, right? Access to good care versus the cost and versus the control. So like in the UK, you have access to good care because you have all the products from Europe. But then the cost and controls, you don't have it as other authorities that could be the US, right? So having that balance very high level, I think is very, very complicated in terms of, and it takes a lot of years. And I think like this is reflecting in terms of the trend that we wanted to share. Why now? Why high regulated countries are starting to talk? Because 15 years ago, 10 years ago, I've done so many submissions based on reliance. It was more implicit reliance, right? So you will go to a specific country in LATAM or Middle East and so on and say, okay, send me the US FDA certificate, send me the CMR certificate. But now are the specific high regulated countries that is starting to accept and then creating those routes. So I think that one of the bottlenecks, obviously, now more regulations, more requirements. So every country is adding their own requirements, specific local, requirements, and obviously they need resources and expertise. So there's a global bottleneck in terms of sometimes the policymakers, obviously with the, I believe with the good intentions, they put a lot of requirements, but they don't realize all the people that need to follow that. We have a lot of examples that are very recent as well in the Middle East that said, one country said, from next month, every device has to be registered. And they have a department with 4 people. And they were like, how are you going to do it? It's impossible to do that, right? And this is what we wanted to highlight, that traditionally only low and moderated regulated countries accepted overseas reliance. And this has been so common, right? So I think the high regulated countries is where they have this challenge right now. And we're seeing this trend that is evolving in terms of, high regulated countries. They are struggling as well with resources, how they can accept, overseas reliance, overseas evidence in order to have a much faster or more reliable as well processes. And then one of the things that we wanted to highlight as well, Steve, is what is the state of play? So what is happening, right? So we wanted to give an overview. So, from our side as well, like overseas recognition, overseas reliance, institutions reliance, that is still very important, the institutions reliance, a lot of like 1345, 60601-1. And then obviously the non-regulated countries, they don't need anything because obviously, it's not applicable. Low regulated countries, common, less common, institution reliance, mainly is 1345. Medium regulated, obviously, it decreases the overseas recognition, and then you have more overseas reliance because they're starting to have more infrastructure. And then the high regulated countries, what is changing is they have their own national conformity assessments. But one thing that we wanted to highlight as well here is for high-risk devices, a lot of countries, they are developing their own pathways, right? So obviously we have the exception with the UK and Switzerland that obviously after, what happened at the breakup and so on, they're trying to figure out how they move to other areas or which path they have. So I think that's why we put it a question mark. But what we can see in here is there are more paths that have been published by high regulated countries related to overseas reliance. So in your opinion, why do you think we're seeing this trend? Is through the work of IMDRF, or is because the need they have to provide to the patients better care in terms of like devices? What are your thoughts related to why we are seeing this trend in terms of all these routes that are opening for high regulated countries?
Well, I think you're right to say that the a lot of low and middle income countries have had reliance and recognition for a while, but it's really important to make sure that actually those low and middle income countries have higher standards. So I think raising the global standards is really important. But then you look at kind of some of the small market countries, Australia, Singapore, Switzerland, UK. Actually, they may not have the resources to put in that full national conformity assessment for all devices, that FDA style thing that you mentioned. So it's how do you make the best use of those resources and still make sure your patients have access to all the health tech that they need to have access to, where there's that clinical need. And then I guess you're adding on, the points that you've made very well over the years, Ivan, is the regulatory complexity. That increase in complexity means that you need more people to be able to look at the regulations to say, yes, this works or this doesn't work, and that workforce just isn't there globally. It's not possible for every country to have full conformity assessment on their own, or even every jurisdiction. So we need to start sharing. We need to start sharing our conformity assessments. We need to start sharing our global standards. We need to start figuring out a way of sharing some of that particularly amount, the workforce resource. It's not easy to be a regulator. It's not easy to convert from other subjects into health tech regulatory. So it's a restricted resource which is precious, which we need to take the best advantage of.
And following that as well, we see in institutions reliance as well. In Europe, we have that. So is obviously the notified bodies, they are the ones doing the assessment. In the US, they have the third-party review. They select which product codes they can be reviewed by a third party. And in other countries as well, we've seen this as a normal practice. So do you think that trend to use the institutions reliance is due to resources, expertise, constraints?
But yes, but it's got to be risk proportionate. It's got to be so we talked about the low risk devices there, and the US choosing which products will have that can go through that reliance route. It's got to be risk proportionate. If it's either a low risk device or a very well established manufacturer with a very well established device and lots is known about it and it doesn't cause problems, then maybe they're great candidates for reliance for recognition. Then perhaps where there's a little bit, it's an innovative device or it's a high-risk device, then maybe there's a need for a little bit more scrutiny, and that becomes more of a reliance route.
So coming back to the second slide, so kind of like every country is doing their own recipe based on how they perceive the risk, how they rely on third-party institutions, how they rely as well on their own resources, I guess. So I guess there is no one model for reliance. Every country is kind of like building, who they trust, who they get the evidence from, and we will talk about more in the next slides. But I guess it's not like one model that can be transferable to one country to another. Every country is building their own recipe, right?
And sometimes even with the same country, it's not transferable from one government to another.
Correct.
Without getting too political.
Yes. Again, and that's something that we will talk later about as well. All of this is political as well. So all the relationships, whether it's reliance with one country or another as well, is due to political reasons as well. So could you, Steve, explain to the audience as well, how does the process work? So in 4 key steps, how does it work in terms of if someone wants to use reliance, what they need to do?
This was your question. Not my question. I'll go for it. So everybody's got a different classification system, whether it's rules based or list based, as there used to be in the EU. If something if I want to rely on, if I'm a country that wants to rely on a product that's a higher risk elsewhere, maybe I wouldn't be that bothered about it. But if it's lower risk elsewhere and higher risk for me, then that means that I want to have greater scrutiny over that product, and that might be orthopedic implant, it might be AI software, whatever it is. There's as you said, all those political and geographic differences. Those countries that have reliance, and we can talk about those which do later on, actually the conformity assessment route might be different, whether that's through a conformity assessment body, which is designated within that country, or whether it's by something which is more globally recognized. And then I guess it's, well, okay, I can do it. The process exists, but is it worth it? I think, what would be less welcome is where somebody proposes a route which is technically acceptable, but is actually not very worthwhile. So nobody uses it. And you can say, oh yes, we've got a reliance route, but nobody actually uses it. And that's not very helpful, because that doesn't give that patient access. It means nobody's exposed to the product, because nobody has access to the product. And then I guess it's kind of, well, this is where regulatory affairs comes in. It's can you actually go through that process such that there's a product in that country, authorized in that country, which is adopted and used for the benefit of patients.
So what you're saying as well, so what is good for authorities as well is to show cases of manufacturers that use reliance, so they can just build the trust as well with manufacturers, right? So nobody wants to be the first. So obviously, it's a work as well from the authorities, just to build that trust, right? If we see if anyone in the audience wants to do, if there is whether there is a reliance in a specific country, it's very simple. You just go to check the risk classification rules, and they will tell you as well whether it's reliance exists. One of them that we used as well, Steve and I, in the work in the past we've done together, is Australia. Australia has a very good framework, and you can see by risk class as well what is accepted, right? And then you need to consider also the benefit, as you say, Steve, and then obviously you apply the submission and the conformity assessment, which it will be very dependent. But I think one of the two things that we want to emphasize is you need to check the risk classification rules in the new country, not in your where you have the approval already, and then check if there are reliance options, because depending on the classification at the recipient country may accept a 510K or a PMA or nothing. So you have obviously all those options. The same as, for example, if you have a class 3, certification and so on, you may have or you don't have it, but it's the class 3, in the recipient country, you may not have chances, obviously, to do it. In terms of the practical case that we wanted to, for a high regulated country, like there is a lot of buzzwords, a lot of discussions about US 510K. We talk about Switzerland. I think it's been mentioned as well for UK. So we think it's a good unique case as well, because as well the 510K is completely different from essential principles, ESPR's approach. We have as well a discussion, Steve and I, we were talking with authorities as well. People are asking, but what are the essential principles? No, in the US, they don't exist. And sometimes, it's quite challenging as well to match those expectations. So Steve wanted to go through, obviously, what are the potential benefits, what are the challenges, and then, we can put this as a very good, for example, approval process is clearance, in terms of clearance process, but that it can be used overseas, but obviously it has those, but obviously it has their benefits in the US and in other countries as well.
Yeah, I mean, 510K, you're right, is a unique case, but there are some really, really good case studies out there. And I know that manufacturers have been happy to share their case studies with regulators to say, this is how it's worked for us. We've taken our 510K and we've used our 510K files to demonstrate that it's acceptable in the other country, and sharing those case studies with regulators saying this is how it all works is really, really helpful. So 510K, we've talked about what the benefits of reliance are generally, but for 510K, using that FDA, the global credibility of FDA is something which should not be underestimated. If there is a problem with MDR and IVDR, and we are seeing some transition problems with MDR and IVDR, and we don't know how many manufacturers are going to use those end of transitions as a breakpoint and rationalize their supply chain. So there could be some disruption. Actually, having that another country to rely on or recognize one will help to ease those supply chain disruptions. And also, 510K doesn't rely on conformity assessment bodies. So you're kind of using a little bit of the US resource, but that does mean that there isn't the pressure on the notified bodies. However, and it's not necessarily unique to 510K, but it has happened with 510K, is there have been some historical problems. Yes, we saw some of these problems with CE marking, so it wasn't just the US regulatory system or the EU regulatory system, as a global regulatory system that perhaps needed to be strengthened. And we have seen that strengthening. We've seen MDD and IVDD move to MDR and IVDR, but we've also seen improvements in 510K. The use of predicate devices is something which is often sticky for a lot of regulators, but actually having an older predicate from 1976, which has not been on the market for 50 years, is not in anybody's interests. So phasing out of those older predicates and using more recent predicates for a 510K is something which can only be a benefit and for building up that trust. Having a globally accepted quality management system such as ISO 13485 is also makes that 510K approach more trustworthy, and having more post-market surveillance. That's probably an issue with the 510K. That is the historical lack of post-market surveillance. Having more of that post-market surveillance in place is something which is building up that trust. Maybe something around clinical evidence, maybe building up more building up the story and building up the requirements around clinical evidence could actually help to kind of break down that one last barrier. But actually, in addition, just building those trustworthy relationships, sharing information. So we have some information about vigilance and performance, which is publicly available, and some which could be shared between authorities. Having that information sharing agreement in place would be really helpful. Perhaps actually, yeah, some of those concerns don't apply to low risk and well-established technologies, so they don't need, the concern about 510K doesn't really apply to those. But having a higher scrutiny for the high risk and the innovative products, and a more robust post-market scrutiny overall is something I think which will mitigate some of those concerns. I also hear concerns from smaller domestic companies saying, well, how can I compete on this global stage? I'm just a little guy. Having pathways for those domestic technologies, whether that's tax incentives or fast tracking, or other ways of incentivizing those domestic technologies, I think will be really helpful, and will help to make 510K. And we'll see later on kind of the global acceptability of 510K compared to CE marking. Actually, that might mean that more products available in the US that are benefit to US patients could also be a benefit to other patients across the world.
Right, and I think one of the key challenges as well, I want to put emphasis as well in one of the challenges is about the clinical evidence. 510K per se doesn't require clinical evidence. I've seen some comments that they said the US FDA has essential principles. Okay, if you have it, you can send it to me. No one, even the policymakers in the US, they don't have essential principle checklist. So when we talk about essential principle checklist, it's a checklist where you have all the requirements, essential requirements that you need to. And one of the key things in the GSPR, essential principles, is clinical evidence. And you don't have that, for example, in the US. And that's one of the key discussions as well with the UK regulators and so on, is how do we bridge that evidence, right? Because we have internally, in the UK, specific essential principles that tell us you need to have clinical evidence, but you bring in a 510K that actually may not have any clinical evidence. And I think that remains one of the key challenges, for authorities, how to bridge. So when we're talking about this acceptance with actions or reliance with actions, these are the actions that people are trying to, or countries are trying to add on top, how they can bridge with their policies and as well their systems. In terms of the moving to the next slide.
Ivan, I'm just looking at the comments between Tammy and Fatima in the comments, and I agree with what they're saying, but I think the essential principles don't exist as a single high level checklist. They are embedded within the requirements. And I think this is something that you taught me, Ivan, is kind of, yes, those principles are there, but they're very, very product specific.
Yeah, that's correct. But can anyone share essential principles that you need to sign, as you need to do in other? You don't. So, that's the key thing. So what are the challenges and insights for future trends? So I know we have 17 minutes. So going over the challenges, obviously, not necessarily understand well other countries and approaches. We've seen this, very much as well in terms of the different type of registration and so on. If any one of you has done any specific global registration, you probably have felt the struggle talking with the country representatives, with the regulators, and so on. Most of the times they are limited with budgets. They want to find solutions. Mostly it takes time and involves policy and breach reliance with their systems and politics. And sometimes that takes a lot of time. And what we wanted to highlight, Australia by far has the most detailed and mature framework for reliance. In terms of insights as well, something that Steve mentioned before, recognition and reliance is easier to achieve at the QMS level because obviously it's easier to meet those QMS requirements. But in terms of the product assessment level is where the device risk and the benefit risk plays an important role. And then that's where the perspective and as well their own historical reasons as well based on those countries may have a specific important role. MDSAP is a really good use case. It's very well accepted as well for QMS. One of the key challenges as well, and we see as well with the steps with the US to get closer in terms of the QMS, for example, with the 3045, is the main global systems, they work slightly different. So obviously there are practical examples with, we're talking about 510K and EU. And one of the things as well, we see reliance will continue to increase due to resources shortages. So countries are trying just to figure out, what could be the best way for them to allow patients to access to care. Obviously, there are opportunities for raising global standards, improving access, and increasing awareness as well in terms of that patient safety, as Steve mentioned as well. But we wanted to cover what are the opportunities as well for manufacturers, right? So what are the specific opportunities? So obviously that's it can significantly reduce your time to market and resources. You need to find those opportunities. But obviously the day accept overseas, that does not mean that you don't need to still meet the global or the local regulations. Sorry. So you need to still have the labels, IFUs, reporting, PMS. You still need to meet all those requirements. I've seen a question about the changes, so it will be the same. It will be the first acceptance for the recognition or the reliance, but then you need to meet those requirements that they may have for significant change, minor change, notices, and so on. Obviously, with the QMS, we are already seeing the return of investment, less audits, monitor trends. Anybody that is in the MDSAP can benefit from that. I remember back in the days, we have an audit from the Brazilian authority. We had another from the US, another from other jurisdiction. It was like audit after audit as well. And the product assessment and control registrations. So you can consolidate obviously evidence and plan strategically from the start of the projects and the product expansion. Potentially it's less paperwork, and that's what Steve said before is potential. There are like some paths that may not be that clear as well for reliance. And again, one of the key things as well, plan accordingly for clinical evidence and the population cover. This may be challenging as well because in the product assessment, we've seen as well a trend that obviously the clinical evidence is getting more weight in every authority. So obviously you need to plan for the technical as well for the clinical. What kind of clinical evidence do you have? Do you cover as well all the population or representative to the population where you are going? You need to be strategic. So obviously, which evidence is going to give you better goals, identify simple, trusted, and reliance routes, but as well communicate well with internal stakeholders and risk about benefits. So that's important as well because you may say these are the steps that we can do, but this may be the risk as well, in terms of reliance or in terms of other. If you have a proven, for example, MDSAP is something that everybody within the industry can feel the benefit out of it. So it's word of mouth. So everybody can just feel the benefit. So that's less risky in terms of the scale. What are the key benefits as well, Steve? Do you see as well, what are the key opportunities for manufacturers in reliance on top of this?
I think, manufacturers having a more global market is helpful, even for those small manufacturers. I hear a lot of people, particularly in startups, and you say, well, where would you like a regulatory strategy to take you? And they say, I want to go to the US, I want to go to the EU. They want a global market. So these frameworks open up global markets to even small manufacturers. and I would stress again, it's not just allowing any product through. It's raising those standards so that actually only those products which meet those higher standards can have that global market. But if you've got those global standards, if you've got that safety, that quality, and that performance that is required across the world, then you have got a much bigger audience, and that's a benefit to patients. If you've got an innovative device that's meeting a high unmet clinical need, that means that actually you're not restricted to just patients in one jurisdiction. So I'm moving on from manufacturer opportunities to patient benefits, but I think for most of us it's in our interests to serve patients. That's why we're in this business. So having patient benefits around this, I think, is something which is good. It's good for manufacturers as well, and knowing that you can get your innovative new product to larger audience is something that actually should not be underestimated.
And then there are risks as well, right, Steve? So there are risks in all this regulatory world. One of the things that to emphasize, not everything is logical, right? So I've seen this many times in my life in terms of experience. You are in Europe, you have a class 2A, and you go to another low regulated country, and they say it's a class 2B. And you say, why? Because we want it that way. And there is no logic behind, right? So you may as well encounter this problem. So this is kind of the things that you need to highlight as well when you go to country registrations or global countries, that there will be a lot of challenges in terms of, first, of communications, but as well interpretations, even of the same rules that you may have in locally. So processes may add complexities and unknowns that you are not prepared. So if you are not prepared for that, or you have complexities that you are facing, just avoid them. Just go to the route that you know. What is exactly the additional information that is required to close the gap? The reliance processes are not the same in each country. That's something that we said already. So obviously you need to understand how that reliance works in that specific country. You may end up doing more work if the reliance, for some reason, they ask you for a specific format or a specific type of information that may give you more work than using the national conformity assessment. Authorities may not understand well the evidence assessed from other authorities. I've seen this very, very often in the industry. Obviously, if they are more close in terms of work and in terms of like approach, obviously they will understand better. But even if you go in terms of like country registrations, they may not understand that information. And as well, authorities may perceive risk completely different. So you may be in a country, even if you are in a high regulated country, you may go to a low regulated country, a medium regulated country, or even another high regulated country and said, I'm not accepting this evidence because I think you should have been done A, B, and C instead of D and C. So that's something that it can happen as well. So those are the risks. And obviously, in all this reliance is built on trust. So if something very bad happens, obviously that reliance, it may suffer as well from that perspective. So from your side, Steve, like you've been working a lot in terms of like talking about reliance and working with authorities and so on. What are the risks as well for manufacturers from your perspective?
I mean, you're right. Not every authority is the same. That the infrastructure is different. So they may be part of a broader department, and the department may have more or less jurisdiction over what the authorization body is saying. Using conformity assessment bodies is different. Having a local guide on the ground, I think, who speaks the language is something which helps to mitigate that. So being able to understand what the regulations are, because they're all different, and you do this every week. You show me so many new updates and changes to regulations. Having somebody who understands that, having a local guide are all really, really helpful things to do.
Yeah, indeed. And that's as well for global registrations or normal registration, understanding should we use reliance, no global registration. So it's good to engage from the plan. One thing I would say as well, like to companies, you need to look into like 2, 3, 4 years where you're gonna go, not only to the first tier of countries you're gonna go, but those that are gonna open you the doors, to more countries after. So we wanted to finalize with some data, from MedBoard. As we know, we have a lot of data in terms of regulatory requirements and so on. So obviously we monitor 225 countries in real time, 15 regulatory areas. This Reliance webinar is more focused on MedTech. Then we have solutions as well to monitor regulatory news, compliance manager, products information management, and country registrations management. So one of the key questions is, you see those arrows moving from the on the globe, is if you go to one country, where you can go next. And I think that's one of the key challenges strategically that you need to plan, right? So, and as well, you want to answer questions like, based on the current evidence and registrations, for example, you have a class to be based on the UMDR, because some countries, they don't accept MDD certificates anymore. Which countries can we go with Reliance and do this much faster? And I'm pretty sure everybody in the clinical, commercial, and marketing will be as well much happier. So one of the key things as well is to understand as well the data. So we show here like a sample size of the 64 more regulated countries as well in MedTech. Obviously, there are different type of regulatory reliance. So in terms of authorities reliance, so, from our data, the EU CE mark in those 64 countries, the highest regulated countries, can be used in 92% of the countries. So it means like 59 out of 64. There are exceptions. Obviously, you can use that in the USA, Japan, Canada, and so on. Even if you can perhaps, research some of the information, but doesn't, in terms of regulation, it doesn't weight in terms of the product assessment. But you can see as well that the US FDA can be used in 42% of the countries, so it's less. And obviously, it's obviously because the EU countries, they don't accept it, as well, European Union. You have exceptions as well in terms of Europe, United Kingdom. But then there are many local and regional hubs, right? So you have in Australia, you can go to New Zealand. If you are in Saudi Arabia, then you can go to all the countries around, the same with Brazil, LATAM, and so on. And one of the key things as well with all this reliance data is for you to say, okay, I want to end up in 50 countries or 30 countries based on the business and the clinical plan. So it's better for me to follow the CE mark or the FDA route, or obviously there are other considerations right now, that are happy with the CE mark and the MDR. And the other thing is the clinical data and intended use considerations. You may get a 510K, for example, intended use that is not the one that is used in the CE mark, and you want to expand globally with the CE mark intended use. I've seen that many times as well in terms of the global registration. So you need to take in as well on all these expansions plans, the clinical data and the intended use that you want to use and how you want to use it. Obviously, in terms of the institution's reliance, 3045 is accepted with additional certification in 27 countries out of those 64. But they are a contributing baseline to local certification. Obviously, you may require additional certification, for example, South Korea and many other countries. But then in all of those cases, you are contributing to that certification. Obviously, you have the MDSAP. So you have CE mark, MDSAP, you are fully covered, apart from like few exceptions for QMS. But as well, in terms of the product assessment, there are very good institutions reliance, for example, with 60601-1, for electrical safety, that is accepted with the CV certification. So that's the one is accepted in more than 50 countries. So you can leverage as well, that evidence. So, these are data that we have from our databases, but you can see as well how this translates as well in terms of those plans. So if you are a manufacturer in a specific country, you need to decide, okay, the plan in 5 years is to go to 30 countries, where I should go, or maybe you need to separate in 2 different plans. You going to the US that will open certain countries, or CE mark going to other countries as well. From your experience as well, Steve, we see as well the institutional reliance as well, is being used. Does it surprise you, this type of numbers that we see in here as well from, all the conversations with INDRF, as well with alignment, globally as well?
No, it's really good to see that there is so much reliance. I just wish everybody was applying it in a consistent way. So for example, you took up local certification. If your 13485 needs to be accredited locally, then it's not really an international certificate. because you need local certificate in every jurisdiction. So applying true global reliance consistently is, I think, the next step. I think we're starting to establish some key principles. So it's making sure that those principles are now embedded in regulatory thoughts.
And I think that's the key challenge, right? How we can leverage that global access or local access, but taking in account all the individual specific actions, that are required for each specific country. We have a very good comment as well that's why a lot of countries as well, this reliance with country registrations, they add in as well. So thank you, Stina, for that comment. They add in that so as an extra step, so you have that kind of evidence that it's been verified by the specific country. So with this, it's time for questions. I think we still have 5 minutes. So if anyone has any question, we're very happy to respond. I hope you enjoy the overview. Obviously, we can go into a lot of detail. This is an overview, going into each country, each specific case. Obviously, it could be very much more detail as well. So any question that anyone can have, we can answer anytime now, Steve or myself.
Everyone, and Ivan and Steve, thank you so much for the insightful session. I know you've been interacting with the chat already, so how about the FDA essential principles, and you have addressed briefly the questions that we have in the Q&A. So about the changes in registered medical devices, that is the question that we have in the Q&A section. I don't know if you wanted to add something else to that question that we have. So how does reliance and recognition expand to the changes in registered medical devices? And if not, what are the challenges and subsequent approaches to streamline the regulatory work of changes in medical devices into the different countries? So if you want to add something else.
Yes, I think that we were covering the difference between acceptance and reliance. So reliance, you are already doing a registration in another country. So once you have the registration, you need to follow the rules of that specific country. So if they have specific rules for changes, notify major changes, definitions, and so on, you need to notify them. So they will have some kind of mechanism. But again, you need to go to the specific country because they may have a slightly different, from other rules. And obviously you have acceptance, for example, in terms of the UK right now, you can do any changes to the EU devices and it still is accepted by the UK. So I think that the big difference that is to understand the acceptance and the reliance for those as well.
Yeah, and I think this also calls out Tammy's question in the comments about sameness. So I guess what is a change? What is a same device? What is a similar device? What is a change to a device? Having global principles about what that means is going to be really helpful. But then having that consistently applied. So I think watch out if you change your intended purpose or design of your device, that might require a new authorization. If you're relying on an equivalent or a same device or a similar device or a predicate device, I think it's again making sure you've got some understanding the principles of what that means in that jurisdiction. Otherwise, you might fall foul. So even with an IVD, it could be it's a comparator device that needs to be meet certain requirements as well as the device that you're testing.
And that's a very good question by Tammy. By the way, I think from my perspective, a lot of authorities, they have a lot of willingness to do the same. But if you look, then the outputs many times are not the same based on this cultural difference and so on. One of the areas I always look is the definitions of recalls and field safety corrective actions. If you look at the definitions of those across different countries, they vary very much. And you have a new definition as well with the UK that is differing from other jurisdictions that are not very far away. So I think it's a real challenge as well in terms of the sameness as well, how conceptually it can be merge those definitions as well, how people can act the same way to the same risk, right, Steve? I think that's the key thing. And we see as well some willingness, as well as some divergence. So that's why reliance helps very much as well, because you can still accept how the other are doing, respecting how they take those decisions.
we also have another question about the QMS. So it's the concept of having several manufacturers on the same QMS certificate were received or accepted across countries, or there are any country specificities in that sense, so in having several manufacturers on one QMS certificate?
I think I'll leave that one to Ivan.
I think what you is in terms of the 35 QMS. So if you had the principles, you just need to add the local, requirements. You need to add the specific requirements that required for either applying to that specific area or to get a certificate. For example, you need to go to South Korea or to jurisdictions that you need a certificate on top. You will still need to add those specific requirements on top. So you can have several manufacturers on the same QMS, so that's more depending on your specific case. But obviously, you will need to meet all the requirements in all the countries where you go as well. So that's I think it's much easier to keep everything under the same umbrella, but obviously, depending on the case, could be slightly different.
IMDRF Reliance playbook. I think the IMDRF is doing some great work to put together kind of what are those principles of reliance, and it's great to see. And I think it's what I said before. It's having that consistency of definition, having those principles there that I globally agreed are really, really helpful, and we really want to see more of that. Having those principles implemented across jurisdictions in a consistent way is also really helpful. And I'm not sure. I mean, I do hear feedback that not everybody converts those IMDRF principles into a reliance process as consistent as they could. So it'd be good to understand how consistent that is. But really, with the principles are all there, the definitions are all there.
Thank you, Steve. I think as we cover now 1 hour of the webinar, so we can just obviously close the webinar. If there is any specific question that you required, from Steve, from myself, and so on, we will send you an email as well with all specific details. So you can just send us a question following up this webinar. So just to say thank you for to attend. Thank you everybody for your time. We really appreciate that as well. Your interest on the topic. And as well, thank you so much for Steve. It's a privilege to have Steve and to get the insights from Steve as well, in live. So, thank you so much, Steve. It's been a real pleasure, and I hope we can have another webinar very soon as well together.
The pleasure's all mine, and everybody. Thank you so much. Really, really have enjoyed the last hour. Thank you.
Thank you so much. Thank you.